Welcome to the Dental Journeys podcast, brought to you by White Coat Financial. Whether you're a new grad or a seasoned dentist, we're here to share stories of dentists from across Canada, how they got to where they are today, and the strategies that helped them along the way. Plus, we bring in experts from outside of the dental world to share insights on the business and financial side of dentistry, helping you thrive beyond the clinic.
Today, we have Dr. Sean Lim on the show, also known as Oral Surgery Guy on Instagram. Dr. Lim was born and raised in Vancouver and attended UBC for dental school, where he also joined the Canadian Armed Forces. He then went on to specialize in oral surgery and completed his residency in Philadelphia, and he now practices in Toronto, Ontario at Implant Surgical Care. So without further ado, let's dive into episode 11 of the Dental Journeys podcast.
I guess where I want to start is really your upbringing and where you grew up. Maybe walk me through where you were born and raised and what interests you had growing up, leading all the way up to dental school.
I was born for people who aren't from Vancouver, I tell everybody I'm from Vancouver. Really, I'm from Surrey, but shout out to Surrey. I grew up in the Fraser Heights neighborhood. So that's where I grew up. I did elementary school in Wally. I did high school at Holy Cross Regional High out near Fleetwood. And then went to UBC after for both my undergrad and my dental school.
Okay. You're from the hood. You're from Wally, yeah.
Okay. I remember I think it was in grade 4. There was a police chase, went right through the playground.
Yeah.
The whole playground jungle gym thing was axed. It was gone.
Yeah, Wally's a rough area, man. It's obviously getting a lot better now. It's like borderline being gentrified because everyone's developing there. But it was a rough area growing up.
Yeah,
it still kind of is.
It's not as bad as it was, definitely. I go back every now and then to see mom and dad, and I'll pop by the old stomping grounds just to see how things are. But it's a lot better than how it was.
No, 100%. I guess. What led you to go into dental school? Was it something that you knew you wanted to do from a young age, or did you kind of figure it out as you went through the years at UBC undergrad?
I wouldn't say I knew right away. When I went into undergrad, I knew I wanted to do something in healthcare, so I went into sciences. And then it was during that time, growing up, I had a great family dentist. His name was Francis Tavares. He's out in that Metrotown area, Burnaby area. And he was always a good influence whenever I go for the yearly checkups or a cleaning or anything like that. He would always encourage me to consider dentistry as an option. And so it was always in the back of my head. As I was going through my Bachelor of Science, I knew I wanted to do either medicine or dentistry. But what really led me to go choose dentistry at the time is I told myself, I don't want a job that's in the hospital. I want a job that's 9 to 5 where I can control the schedule. And funny enough, I ended up doing residency, so that all was a wash. But that's really what led me to do dentistry at first.
Fair enough. The autonomy and the ability to really just, own your schedule.
Exactly.
And have normal working hours.
I promised myself I would never work in a hospital. That all changed. Did 180.
Yeah, joke's on you, eh? And so one thing that I was reading up about you that I was shocked by, I actually didn't know this. You served in the Canadian Armed Forces.
Yeah.
How did that happen? Why did that happen? What was that like?
So when you're in your first or second year of dental school, the Canadian military will come to your school and they'll make their pitch. We pay for your school, we give you a nice stipend while you're in school, and you work for us afterwards. So I came from 2 blue-collar parents. They worked their butts off to put food on the table, to put a roof over my sister and me and my sister's heads. And they did whatever they could for me. But dental school came with quite a hefty price tag, and I was running off a student line of credit at the time. So they're making this pitch to me, and I'm like, you know what? This is a great idea. And at the same time, it allowed me to serve my country. I was born here and proud Canadian, and very few people have the opportunity to put on the camo and represent the country in that way. And so those things put together drew me to apply for the program, which is known as the Dental Officer Training Program. I applied, was fortunate enough to get a position, and that's really how I ended up with the military.
What what kind of training do you end up doing? Like, do you fully train with everyone who joins the military, and you go through all that brutal training, like the physical training, or is it completely separate because you're going through the dental sort of side of things?
No, so anybody that joins the military does have to do basic training. If you do the traditional route, you do all your basic training at the beginning, and then you start your career with the military. Whereas for us, because we're in dental school from August, September until June-ish, we would do our basic training in the summertime. And because you couldn't do the whole 14, 15 weeks in one go, they would split it up into two. So we would do our first round in between that first and second year of dental school, and then the second round would be in between second and third year. I think for me, I joined a little bit later, so mine was between second and fourth year of dental school. But everybody goes through the same thing. Anybody who joins the military has to go through that same 15 weeks of basic training.
That's crazy. How was that? What was that experience like?
Um, it was challenging. We're a bunch of nerds. We're a bunch of dentists. Like we're not as physically trained as some, but it did. I always look at it this way. Going into residency, you don't get much sleep. So I think my time in the military, at least in basic training, was kind of an intro to that. Waking up really early, 5, 6 in the morning, having to be everywhere on time, being punctual, being penalized if you weren't there on time, and just having some order in your life. That was a little tough at the time, but looking back, it was a good experience.
Yeah, it's probably built these lifelong skills that you probably carry with you all the way till now.
Yeah, I think I had some of it in me already, but being in the military and getting my butt kicked a little bit definitely solidified some of that stuff.
Yeah, I'm sure having just like strict Asian parents, like I could attest to that. It's like, man, my house was run like the military household, just growing up. So I'm sure you just got an extension of that even further in a more formal setting.
Exactly. Ditto.
How many other people were joined the program? Was it just you who did sort of the dental training program through the military, or were there other UBC students as well?
There are students from all Canadian programs, and the way it works is they kind of look at how many people are leaving the military in that given year. So sometimes maybe this upcoming year there's nobody retiring or there's nobody leaving the military to go into private sector. Then they don't take as many or they don't take any at all. But there are years where a lot of people retire or a lot of people leave the military for X, Y, and Z reasons, and they will accept more dental officers in that year. In my year, I think there was 4 or 5 of us in our year, and then I think there was a little less in each subsequent year, but every year had its share of UBC dental students for sure.
Okay, interesting, man. And then, if I'm not wrong here, you finish your dental school at UBC. After that, you're required to work with them for a certain number of years. How did that like play out? How many years do you have to stay on? What are the stipulations around that?
So the way it works is every year that they pay for your education and provide you a stipend, you owe them a year of obligatory service. And then another thing is once you finish dental school, they usually move you away from home. So upon graduation, they will ask you, what are your top 3 choices in terms of locations in Canada where you would like to be stationed? And you give them your top 3. Whether or not they actually look at it or not sure. I remember I put Toronto on that list, and I'm pretty sure I put it first. I knew they didn't like to keep you at home, so I didn't want to waste one of my choices on Vancouver because I knew the chances were pretty low. And I was a big Raptors fan. I'm not gonna lie. That's what really drew me to Vancouver. That's what drew me to Toronto. And I had some friends and family here too, and I'm a big city guy. I like big city. So all those 3 things combined, I was like, Toronto is my top choice. And there is a base in Toronto proper, but those are usually that spot's usually reserved for people who are more senior.
Mm-hmm.
I knew that if I put Toronto, they would probably put me closer to Barrie, which is an hour and 15 minutes north of Toronto, if you're familiar with the Ontario geography. And that's what I put, and that's what I got.
Smart. So tactical decision, and it worked out okay.
Yeah, they at first I remember they had me live near the base, so I was living in Barrie, Ontario. Lasted about 2 weeks, and I was like, "This is not for me." And so I remember talking to my boss at the time, and I said, "Look, I know this isn't usually allowed, but is there any chance that I could live in Toronto? I have some friends and family there. I would like to be close to them on weekends and evenings." a little bit of back and forth, a little bickering, and then a little bit of luck, and I got my wish granted. I was able to live in North York, and I would drive an hour and 15 minutes each way, and that's in good weather. And there's days where it was snowing and it would take 2 hours each way. So there was a lot of times where I regret living where I lived, but there's no regrets looking back.
Yeah, you got that city experience, obviously, being there.
Yeah.
Now, in terms of the work, what was like your scope of practice in the military? What do you work on sort of day to day from a dental aspect?
So you are a full-fledged general dentist with the military. You treat military members only. And looking back, as a fresh grad coming out of school, and this goes for any field, but particularly for dentistry, you really don't know that much. In dental school, you know enough to practice safely, but in terms of your hand skills, you're fresh, you're green. So being in the military really allowed you to hone your skills without the pressure of the real world. You were kind of shielded by the fact that, in the military, you only really see 3 patients in the morning and 2 in the afternoon. Whereas in private practice, even as a new grad, you don't really have that luxury. So for me, coming out as a new grad, doing my first root canal, I remember they would give me a whole morning to do it, which is crazy talk in the real world. But for someone who had done only 5 to 10 molar root canals, it was great. So looking back, it was a great experience and a great way for someone to hone their skills as a new dentist. So to anybody listening to this who's maybe in your first or second year of dental school and the military has come and pitched this to you and you were thinking about it, it's not a bad idea. Get past the basic training. It's not that bad. It'll make you a stronger person. But once you start working, I think there's a lot of benefit in being in the military program for sure.
Awesome. No, I'll be honest, I didn't even know that that's what the path was or the journey to sort of get into it. So I'm glad that we're having this conversation because I'm sure a lot of people just aren't even aware that this is an option or what the path looks like once you started. So I appreciate you sharing all that. Now that you were practicing sort of in the military, what made you decide while you were doing that, okay, I'm going to go and try my hand at specializing? And more importantly, what made you, choose oral surge?
So when I was in the military, to be honest, when I graduated dental school, I enjoyed oral surgery, but I thought I was going to be a general dentist as a career. I enjoyed all the different specialties. I enjoyed doing a little bit of everything when I was in dental school, or at least what I was exposed to in dental school. But then when I got to the base at Borden and I started working as a general dentist, I realized that I wasn't really excited when it came to restos. I wasn't that excited when it came to doing root canals. I wasn't very good at it either. Perio, doing crowns and bridges, just didn't really excite me. The only thing that really got me going and got me excited was doing surgery. And surgery as a general dentist in the military really just came in the form of extractions, a lot of wisdom teeth extractions on 18, 19-year-olds, fresh privates who join the military, because there is a thing where you have to be medically fit, and having your wisdom teeth would classify you as not being medically fit. So you would have to get your wisdom teeth out. So we would have a lot of those cases, and then a handful of implant cases, usually done with the oral surgeon. There's usually traveling oral surgeons that would come into different bases, and when you work with them, you got to place some implants and do some cooler stuff like sinus lifts. So that's where I learned that maybe general dentistry wasn't for me, and maybe oral surgery it's the only thing that got me going. So that's where I really learned that I might want to do that for the rest of my career. And then while I was in the military doing my obligatory service, I took a shot at the CBSE exam, which is an entrance exam for oral surgery. I took it once, got a competitive score, decided to fill out the application and submit it and see what happened, and then kind of took off from there.
Okay. So just shoot your shot and see what happens, right?
Always.
Yeah, no. Fair enough. And I guess how was your time in Philly? Because you obviously got into oral surge. You did your training in Philly. What was that experience like moving down there and living there? Because it's such a different demographic and culture compared to BC or Ontario.
So yeah, to those who are unfamiliar with how the match system works, you apply to X number of schools, and then however many schools will invite you for an interview, and you go for the interview, and then they rank you and you rank them. I remember I interviewed at 7 spots, so I ranked my 7 programs in order based on my preference, and then some weird computer algorithm controls your life. It literally matches you to whatever, however, based on however those programs ranked you. And I remember at the time I really wanted to go to New York City. Didn't work out, but my second choice was Philly. And then that's how I ended up in Philadelphia. And making the move there, you know, having spent my whole life in Canada, moving to the US, although we're neighbors, it is quite different. You know, it felt very different living there. It felt pretty foreign at first, and then you get accustomed to it. But Philly has its pros and cons, just like any other city. But for sure, I was very excited to be able to move back to Toronto when graduation hit. So
Okay, I think that says a lot. Yeah, you're like, all right, I want to go back home.
ask anybody that I knew in Philly; they knew I wanted to come back to Toronto as soon as I could.
Fair enough. And so I guess when you're in residency, obviously based on like clients I've spoken to and just stories I've heard, it's grueling. Like it is a grind. It's difficult. You'll probably be tested more in residency than you ever really will be in the real world. What was the hardest part of going through that period? Was it the fact that you were just away from family? Was it the workload and the lack of sleep? Or was it like the fact that you're like, man, I don't actually know that much and we're doing a lot of stuff here in the hospital setting?
It's everything. I think the toughest part, when I look back, I think the toughest part is, you miss out on a lot of, big life events when you're in residency. The biggest being spending quality time with friends and family. For me, my fiance was very supportive through it all. It's not shout out to all the partners of those like resident partners. It's not easy. As tough as it is on the resident themselves, the toll that it takes on their loved ones is equally as tough. So that was tough for sure. Having to balance life and work when really your life is pretty much almost 100% work. So in that little time that you have, you try and give your friends and family that time, but no matter how much you try, you just can never give enough. And then in terms of the residency part, the lack of sleep, you kind of get used to it. I think the toughest part is definitely when you start. You literally get thrown into the fire. On July 1st of any year, there's a new batch of interns that come in that know absolutely nothing. They're fresh out of dental school and they have absolutely zero experience. And you literally get thrown into the fire and you learn by getting burned. Like there is no other way to put it. You will get yelled at by your seniors. You will get yelled at by your attendings. Most of the times it's not malicious, but that's really how you learn. And then you adapt. You adapt to the circumstances that you're put in. And then as you get into your second, third, and fourth year, there's other, hardships and difficulties that come along. A lot of residency is self-taught. So it's not like dental school where you have lectures from 8 to 12 and then you have clinic in the afternoon. It's really, you're either in clinic or you're in the OR all day, and then you're responsible for your own learning at night in the form of reading textbooks, watching videos. We try and do didactics really early in the morning, like 7 o'clock before clinic starts, or we try and get something in at like 5 o'clock after clinic or ends, but it doesn't always work out that way. But a lot of it is self-taught. And then on top of that, you have to prepare for your cases because, like I said, no one's holding your hand in residency. So you have a whole week's worth of cases. It's your responsibility to read up on them. It's your responsibilities to work them up. It's your responsibility to make sure that if they're super sick people, you get all your clearances from their primary care physicians or their other specialist doctors. So, a lot of things that I fortunately don't have to do nowadays are on your shoulders when you're a resident. So difficulties in residency definitely come in many different forms.
Yeah, it just sounds like such a gruesome, brutal experience. And I've always joked with like some of my clients who are in oral surgery and friends, and I was like, at least you won't have imposter syndrome coming out of this, because you get worked so hard that you have to outwork that imposter syndrome. You show up on your first day and sure, you don't know everything there is to know, but you feel pretty confident that you're like, okay, if I could handle residency, I'll be able to handle, wisdom tooth extraction or something just fine.
Yeah. So I would say I came up pretty, I can't speak for every program, but at least at Jefferson and Philly, they whip your ass quite a bit, and you come up pretty prepared. So I came up feeling pretty ready.
I gotta ask, just based on your Instagram and some of the photos I've seen on your page, and just photos I've seen from like, friends and clients, and the stuff that you guys see, I'll tell you right now, I couldn't sleep at night if I saw that stuff. What was the wildest case or the wildest situation that you had to deal with in residency? If you're cool with disclosing.
Yeah, wild comes in many forms. I think while I was in Philly at Jefferson, the wildest ones were probably gunshots. There's sad situations where people attempt suicide or there's domestic violence, things like that. And you see people come in, their faces are completely blown off. And then now it's the responsibility of our team to put them back together. Sometimes we are able to put everything back together, and sometimes you're not able to. And sometimes you're forced to reconstruct those injuries with what we call free flaps. So we take bone and soft tissue from other parts of the body and we use it to reconstruct. So you see a good amount of those, especially in Philly, a city that's a little bit more rough, a little bit more ghetto. You see a lot more of this stuff. So in terms of craziness and what gets your adrenaline going, probably that. It's nothing that you expect. There's other crazy cases, for example, people with cancers of the jaw, where we have to resect the whole jaw. We take a piece of leg bone called the fibula, we put it in there to replace the missing jawbone, put implants in the leg bone at the same time, and then replace missing teeth with a prosthesis all in a day. It's called jaw in a day. We were able to do a few of those in residency, which are super cool too. Super long surgeries. Start at like 7 in the morning, you don't get out till like midnight. But then in terms of like that adrenaline rush, probably the trauma cases, so the gunshot wounds, because you don't know what you're going to expect. Things just kind of hit you when they hit you, and then you kind of roll with the punches. So
yeah, that sounds insane. I didn't realize how common gunshot wounds are until I spoke with a few people. Cause I was like, oh, you probably deal with like one of those, and they're like, no, dude, it happens way more often. Obviously, maybe not in like Vancouver and Toronto, but bigger places, New York, California, Philly, you name it, you're probably going to see more of those in like rougher neighborhoods.
For sure. I don't have any regrets going to the US to train. Guns are a lot more abundant down there, and you get to see a lot more of this crazy stuff, which I'm very thankful that in Canada we don't have that much of. But in terms of training and being ready and knowing how to treat those kind of injuries, it's something that's invaluable and something that I'm glad I was able to experience.
Yeah. Now, in terms of starting in residency, you mentioned it, you're so fresh, you don't really know that much, and you kind of learn as you go. How did you overcome, I asked this to everyone, how did you overcome that feeling of like taking a leap of faith, or just kind of like not winging it, but like, all right, I'm going to try my hand at this, even though I don't feel fully confident with this procedure. This might be the first time I do it. What do you tell yourself in those moments? How do you get past that initial, what's the word? That initial like friction to go and do something like that you're not fully confident about?
So when you start residency as an intern, you're kind of a scut monkey. We've all been there. You do all the behind the scenes tasks. You don't really get to get your hands dirty when it comes to surgery. But then you spend all this time reading, and you spend all this time preparing. You read all these textbooks, you read all these PowerPoints, you watch all these videos, and then there'll come a time in residency where it's next batter up. You're up. It's your turn. And if you don't take that leap of faith, someone else will. It could be another resident. It could be a junior. It could be your attending not realizing that you are not ready for the moment and just taking that opportunity away from you. And that opportunity that you're presented with, that one case, may be the only time you see that particular case. So if you don't take the leap, you miss out. And then when you graduate, if you see that case again, you don't have that experience under your belt. At least that's what I told myself. There are definitely moments in residency, there's a lot of times where you are faced with situations where you're scared. You are nervous. You've never done this before. You've watched a billion videos on it, but now it's your turn to do it. And you just have to tell yourself, you worked your ass off to prepare for this moment, and you just have to do it. Fortunately, in residency, you are still under the wing of the hospital, of your oral surgery program. You have someone watching over you. You have an attending watching over you. So you're not really on your own. Whereas now, as a as an attending or graduated oral surgeon, everything's on you. So in residency, you take the leap of faith knowing that you kind of have a safety net under you. And so that's really what got me to take that leap of faith in those moments where I felt a little bit, nervous about things.
Fair enough. It's nice knowing obviously you have those people, but it's still scary nonetheless, because it's not just extractions at that point. Like you said with that jaw and a day surgery, it's like, okay, there could be a lot of complications here that I'm try my hand at, and hopefully I do a good job for this patient, because it's their face. They're gonna have to live with it for the rest of their life, and all the other things that could go wrong. So hats off to you guys, man. I don't know how you guys do it. I'll tell you that right now.
And complications happen to the best of people. Complications will happen. It's just how you deal with it. There's no perfect clinician or physician. Everybody makes mistakes, and it's just really how you deal with the mistakes that come about.
Yeah. Tell me about how you deal with, I would say, the pressure of the job that you're doing. Because obviously there's high stress situations, especially in a hospital setting. What kind of goes through your head as you're working on these procedures, especially if there's like something that's urgent, a trauma case, something you have to work on quickly? Is there just like a state of flow? Are you actively thinking about what you got to do, or is there like, this fear in the back of your head? What goes through your head when you have a trauma case?
So, at least for me, and I can probably speak for a lot of other surgeons out there, when we are presented with a case, whether or not it's a scheduled case or an emergency case, before you walk in the room, you've already thought in your head, these number of things can go wrong, A, B, C, D, and E. And you should already be prepped in your head. If any of these things happen, you have a solution to each and every one of them. That way, when you start the case and you take that leap of faith, you really are prepared for anything that may come about. So, for example, you're taking out a tooth or you're doing an implant, you go over all these possible scenarios in your head, and then you tell your staff, I need these instruments or these materials in case this happens, so that when it does happen, you're not scrambling to look for this and that. Like, everything's already ready to go. But definitely part of preparation, or the most important thing in preparation, is to think of all the possible complications that can come about, and having everything ready so that when they do happen, and they will happen at some point, you're ready to go.
Fair enough. And when let's say you finish one of those intense, procedures, what's the feeling like after that? Is it relief? Is it like a thrill? And I was joking with you when I sent you an email. Does it feel like a game-winning shot, or is it just like relief, or is there uncertainty of like, I hope this holds up and I hope they don't have to come back?
A little bit. There's a little bit of uncertainty, and there's always a little bit of luck in what you do, especially for trauma cases and emergencies. But no, like there is a rush in that you're able to. What I love about the job that we do is that you are often faced with issues, and we are able to fix those problems with our hands right now, there and then. And there's a big satisfaction at the end of each case. There's certain jobs where there's a problem and you do something and you don't get to see the fruits of your labor right away. Whereas with our job, if someone comes in with a trauma, we fix it right there and then. We see the results of our work. If a person comes in with a bad tooth, we take it out, we put an immediate implant in, we see that result right there and then. And that's probably the best part of this job is the instant gratification that we're able to provide the patient and also provide ourselves.
Yeah, no, I like that answer. I guess let's fast forward to today. You're obviously back in Toronto. Walk me through your day-to-day of what you're doing now, and really like your scope of practice.
So I work in Midtown Toronto, corner of Yonge and Davisville. I work at a place called Implant Surgical Care. You can see right here. I work with a couple other oral surgeons. I work with Leslie David, who is an amazing boss, an amazing mentor. Very fortunate to be where I am today, and under her mentorship, I'm learning a lot. At the same time, able to do what I love. And then we also work with Dr. Jonathan Pong, who's another oral and maxillofacial surgeon, and Dr. Sharice Tafik, who's a periodontist who also works in our clinic. In terms of our day-to-day, every day is a little different. It's always a mixture of some consults, a lot of procedures sprinkled in there. We do a lot of IV sedations, and for cases that are a little bit more difficult, we have an anesthesiologist that comes in 2 to 3 times a week, and he will help us take care of the general anesthesia part of things while we focus on surgery. In terms of scope of practice, mainly dental alveolar, a lot of wisdom teeth, a lot of implants. Davisville is a more affluent neighborhood, so we see a lot of people who come in and want to get their teeth extracted but not walk out with no teeth. So we'll do a lot of immediate implants. So that's a big part of our practice. We also do bigger implant cases like all-on-4 cases, some zygomatic implant cases. And then 1 to 2 times a month, I'm at Credit Valley Hospital in Mississauga, Ontario, where we do bigger OR cases. So orthognathic cases, if there's trauma from being on call, benign pathology cases, things like that, we'll take to the OR. So that's once or twice a month.
Okay, so you are still sort of back in a hospital setting some days.
I know. I said I didn't want to work in the hospital, right? But there's cases, the bigger ones, where you're only really able to do them out of an operating room. And in Canada, it's quite tough to be able to land a position like that. Fortunately, I found myself in a situation where Leslie was able to bring me on as part of the staff there, and I'm starting out working at the hospital now. So that I feel very fortunate and blessed to have that opportunity.
Solid. Maybe you could tell me, now that you've been practicing for a little while, it's been obviously not very long, but now that you've sort of in the groove of things, what would you say is the best part of being an oral surgeon so far, and what's the worst part?
I truly enjoy what I do. Like, I truly enjoy taking out teeth and putting in implants. It's what I enjoy doing as a general dentist, went through residency, and even through 4 years of residency is still what I find the most enjoyable. I do like hospital-based procedures too, orthognathic surgeries, trauma, things like that. And so having 1 to 2 days a month to be able to do those things and kind of change things up and spice things up a bit is nice. But being able to do what I love, being able to, like I said, help people out and see that instant gratification is a nice thing. It's a nice thing to be able to do on a daily basis.
Solid. What are you most thankful for that to your younger self? Or like, is there anything that you would change in hindsight based on your career so far?
What would I thank my younger self for? I would probably say the work ethic, the hard work. I really took after my mom and dad. 2 immigrant parents, like most immigrant parents, 2 blue collar workers, trying to, like I said earlier, trying to put food on the table, trying to put that roof over our head, paycheck to paycheck. They would always work long hours, take care of all the housework, and never complain. And that's something I definitely took from my mom and dad. So shout out to mom and dad for teaching me that. And that really helped me get through undergrad, dental school, and most importantly, residency. Because in residency, there's no time to complain. There's no time to whine and moan about doing this and that. You just have to get it done. And that's what my parents taught me, and that's what really got me through that. And now I've carried that forward to my career as well. A lot of people think that once you're done residency, life gets a lot easier. I don't think it necessarily gets a lot easier. You have a lot more responsibilities. You have to think about other things like incorporation. You have to think about your schedule. If you're a business owner, you have to think about how to run a practice, your staffing. Someone quits on you one day. Now everything's, in flames. Like, there's a lot more responsibilities and other things you have to worry about outside of residency. So I don't think coming out of residency is any easier than residency itself. But I've stuck to it. I've stuck to maintaining that work ethic and putting my head down and grinding. And I think that's what's gotten me to where I am today. And I hope that will continue to allow me to go up and rise. So.
Respect, man. Respect. I hear you. What would you say is next for you as Sean, so personally, and then as Dr. Lim, professionally?
For me as a person, I think just one thing I will say is sometimes you get bogged down in residency and your career. I think being able to take a step back and relax a little bit, spend more time with friends and family, do things that I love but haven't had the chance to in the last little bit. My fiance and I love to travel, so trying to get some more traveling under our belt is definitely something that I want to accomplish for myself in my personal life moving forward. And then for me as a doctor, I would say really just honing my skills and building my practice in Toronto. I'm still relatively new and I still have a lot of ground to lay. So getting my name out there, building my practice, and then hopefully in the future, having some sort of ownership, whether it be my own or being a partner in a practice is definitely on the radar and definitely something I want to accomplish for myself.
Solid. No, thanks for that breakdown. But yeah, honestly, you miss out on so many years in residency, and anyone who didn't go through dental school is, they get their jobs and they start working and they get to really enjoy their late 20s, whereas you guys, you're just grinding until you hit your 30s, and so you almost have to make up for lost time now.
There is a lot of lost time, and like I said, shout out to the partners of residents because they lose out on a lot too. It's it's friendly fire. They unfortunately get hit with it. So I owe it to my fiance, I owe it to my family and friends to give them back that time that I wasn't able to for the last 4 years.
Yeah, no, I love that. We'll close out this sort of episode with a bit of rapid fire. I thought I would make it a little bit different than a standard questions. Yeah. I know you're a big foodie, so what would you say is the best meal you've ever had in your life?
Ooh, best meal ever?
Yeah.
I love my mom's cooking, but we're not going to say that. I want to say it's going to be tough, but in the last 3 months, I'd probably say in Toronto, Osteria Julia. If you ever make your way back to Toronto, Osteria Julia is a great spot for Italian food. Highly recommend.
Okay. What about maybe international, somewhere outside of Canada?
Ooh, international. I don't even know the names of these places. I proposed to my fiance on the Amalfi Coast in Italy, and their food is just like their seafood is just so fresh. So you just get, linguine with olive oil base and fresh seafood. Couldn't tell you the name of the place, man.
Yeah.
But it was fire.
It was the best. Okay. Fair enough. I guess the next question is, professionally speaking, if you could be anything in the world, what would it be?
When I was growing up, man, I want to be either a basketball player, be the next Spud Webb, didn't work out. And then I, at one point, wanted to be, I'm a big sneakerhead, or was a big sneakerhead. I'm trying to get back into it. Residency really killed that passion. But I wanted to be a shoe designer. I wanted to design shoes for Nike or Jordan. So both of those things didn't pan out, so I became a nerd.
Could you ever see yourself going back into that? Just, on the side, making a couple sketches, seeing if something works out?
I think the hoop dreams are definitely dead.
Yeah, of course. Fair enough.
Shoe design, oh man, if you ask me to draw a tooth, I can't even draw that for you. So you don't want me drawing shoes, nah.
Okay, fair enough, man. And then on that same note, if you could wear one pair of shoes for the rest of your life, any sort of type, what would they be?
Oh, the answer's right here, man. Yeah, Jordan 1.
Jordan 1, okay. It's a classic.
Jordan 1s are the best, man. I got a couple pairs of Breads ready at all times, a couple pair of Royal 1s. Those are my top two for sure.
I was enjoying those stories, and you guys just stopped them. I would assume no one could keep up with the sneaker game.
Dr. Sonata, I got to get back on it with him, but I got to buy more shoes. I haven't bought shoes in a minute. I think the last pair I bought was, I want to say, Off-White Prestos. That was like, we're rewinding the clock probably like 5 years. So
so it's been a minute.
I owe myself a pair now.
Yeah, no, for sure. Bench, start, cut. I know it's a tough one. Kawhi, DeMar, Bosch. What are you saying?
Ooh. Okay, I'm gonna say for sure start Kawhi. For sure. Bench, I would bench DeMar because he likes to do that iso ball stuff at the end of the game and then throw up a break every now and then. He'll occasionally go in, but I'll bench him. And Bosch wanted to leave on his own accord, so he's cut, man. He's done.
He's cut? No loyalty there, eh?
No, he's done.
All right, last question. Top 5 Drake tracks, according to you.
Oh, man. Top 5? I could do top 50.
Yeah.
we gotta look at the situation here. So when I'm in my feels, Marvin's Room for sure. If I'm chilling, Crew Love. I know they're beefing right now, but Crew Love always hits the spot. Another one, an oldie, worst behavior is a good one for me. If I'm
When you're just in that bad mood, is that?
When I feel badass, worst behavior. And then, when I'm at the gym, when I need a good warm-up song, Knife Talk, always hits. Always hits. And then I love a good Drake feature, man. And I'd probably say top 2 Drake features, Rico with Meek. And then you have, I'm going to swear, but fucking Problems with ASAP.
Yeah.
Always hits.
Yeah. No, that's a respectable top 5.
Top 6, I know. I can.
No, it's hard, man. Sorry?
Yeah, I said it's too hard to do 5, man. I had to slip an extra one in there.
Yeah, no, he's just got so many good songs, and it's like, all right, it's impossible. Plus, obviously, you get to live in Toronto, you get to be in Toronto. It feels different in that city, honestly, just knowing he's from it. Here on the West Coast, every time I'm in Toronto, there's a different energy to that city. I will say, and I wonder if you'd agree, BC's way more beautiful. Just like natural beauty, you can't compete. But Toronto, the vibe of that city is just different.
So people always ask me, are you going to move back to Vancouver? And I will never argue that Vancouver's, nature. You look outside, you see the mountains and all that. You see green, you see trees, you see hills, like all that. Great. For me, I'm a big city guy though, so I needed to be in Toronto. I fell in love with the vibes of the city, like you said. There's always this different energy when you're here. But one thing I loved doing when I was growing up was go to Cyprus or go to Whistler and board. Ever since I moved to Toronto, they don't have mountains up here. They have this thing called Blue Mountain out here, and they think it's a mountain. It's a hill. It's not even that. So that's definitely the one thing I miss about being in Vancouver. So now that residency's done and I have some more free time, I promise myself we'll be going out back west every year. Get a cabin up on Whistler, ski in, ski out. Do that at least once a year, because that's something I really miss.
Yeah. Plus, you get to see. I would assume your parents are still here.
Yeah. So I'm actually back in Vancouver pretty often. Okay. I'll make weekend trips or long weekend trips to see mom and dad. Heading out there for a wedding this summer, George and Ashley. So I'll be back for that. And then, I find myself in Vancouver quite often. But that's probably what I miss the most. Awesome. And the air is a little bit more fresh out there too.
Yeah, the air is a little better. I feel like the water tastes a little better out here too. It's funny. I try to argue with my wife to get us moved out to Toronto, because I think I'm the same as you. I need to be in a city, and I just love the energy of being in Toronto. I feel like every time I'm there, my life just gets a little bit better.
There's something like it's that big city vibe. There's always something new. Like in Vancouver, I think things move a little bit slower in terms of like new restaurants to try. Artists coming into town, throwing concerts down. NBA's here, MLB's here. You got the Bills right across the border. There's a lot more going on around here, but that's not to say Vancouver isn't a great spot. There's the things I miss about it, but Toronto's my city now.
No, fair. Well, I think that's a perfect spot to wrap it up, man. I appreciate your time. Thanks for doing this. Thanks for sharing your story. I think this was super helpful for anyone, honestly, who's a new grad wanting to know the different path on how to get to oral surge, or even learning about that, going through the armed forces. So thank you for going through this with us, man.
No problem, man. Appreciate you having me. I'm honored.
And there you have it, episode 11 of the Dental Journeys podcast. Thank you to Dr. Sean Lim for recording this episode with us. If you'd like to connect with Dr. Lim, as always, we've included his social media link and website in our show notes.